that delay in replacing high-risk blood products from overseas had disastrous consequences. Who should bear responsibility for that delay?
One of our difficulties all the way through has been to discover documents which shed light on precisely that. We know that there wasn't sufficient plasma produced by the blood transfusion service certainly up to the end of the 1970s. We know that even if it had been produced, it couldn't have been processed by the processing facilities. What we don't know, because we haven't had access to any evidence on the question, is whether the people who were working at Oxford or elsewhere wrote to the government or submitted minutes or said, look, we've got problems here. We can list now what was wrong with the facilities. They simply couldn't cope with the additional amount of plasma and other blood products. But what we do know is that they hadn't sufficient storage space. They were managed by people who were very distinguished scientists, but who had no experience in industrial production. And so, if someone had looked at this earlier than they were in fact looked at, then a great number of lives would not have been subjected to American imports, and they might not have been saved. But I don't think we can say very much more than that.
Can I just quick supplementary? You said right at the beginning that questions have been asked about whether successive governments should share the blame. Have you answered that question? Should successive governments share the blame?
We haven't actually said they ought to share the blame, no. Because any of us here who've been ministers know that we get on with ministering what we know about. We can't search out everything we don't know about. If somebody doesn't tell us what the position is, then it gets overlooked, and then they say, oh, the government hasn't done anything about it.
Just finally, how much of an hindrance has it been to you not to have some of these documents, key documents, which still have not been released by the government?
Oh, we could have done a much better job. The documents which now exist and haven't been released. Since we don't know what's in them, we can't say what we do about them. Documents which have been mislaid in the meantime, and evidence which might otherwise have been available, would certainly have been much more enlightening than what we had. I don't think we can answer that question more precisely.
Alison Mackenzie, ITV Regionals, lots of people from our patch are very concerned about this. You talk about how commercial pressures overrode those matters of public health. In what way? Can you outline what way those commercial pressures took precedence, please?
Yes. A great deal of the shortfall from what was produced in this country came from commercial sources in America. That had two consequences. One which seems to have weighed with some people in this country, with some officials certainly, was that it was more expensive because it carried an element of profit, and they paid the donors. So it had that effect, and consequently probably there wasn't so much of it available as there might otherwise have been. But more importantly, it had been produced in circumstances which had made it susceptible to infection. And so 40% of the blood products which were available in this country in the mid to end of the 1970s were produced here. The remainder came from abroad and from commercial sources. And that was the majority of the infection.
Jane Hughes, BBC. Your report makes it pretty clear that people with haemophilia in this country have been let down. Can you put a sort of a quantification on that? How badly would you say people have been let down, and where would you point the blame?
When you say how badly have they been let down, obviously if your life has been ruined, that ought to have been recognised and so far as possible compensated for. I think,